Good afternoon to you all. My name's Granite. I'm a doctor here in the UK. I graduated from Medical University in Bulgaria in December last year. So welcome to today's Medipath International talk on building your portfolio, clinical attachments, and we're also going to talk about some of the steps you need to take to obtain your GMC license and what you need to do as soon as you graduate or just before you have your graduation ceremony. Now, today we're going to focus on mainly the steps regarding licensing for EU graduates. However, if we have individuals here, I can see we have some people which are not EU medical graduates or to be medical graduates. There is still a lot of relevant information here regarding what you can do to increase your opportunities to get a job after you graduate here in the UK. So I can see we have people from Bulgaria, from the same university that Talha and I graduated from, and Sri Lanka as well. So very nice. Any other places? Guys, write in the chat. We love to see where you're all joining from today. So keep us intrigued regarding that, yeah? So we're going to start now, and Dr. Haroon, you can introduce yourself, and he's going to go through the first presentation on portfolios and clinical attachments. Over to you, Talha.
Hi guys, so my name's Dr. Haroon. A bit about myself first. I also graduated from Plovdiv Medical University recently 4 months ago, actually in December 2025. And I'm hoping to just give you guys a bit of an insight into building your portfolio, kind of getting the most out of your final years, your 5th years and your 6th year, and then how to kind of transition from your final year into a clinical setting through a clinical attachment. So I'll just kind of start off with a bit about, it's just going to be a kind of shorter run through because I can go on for hours and hours talking about how to build your portfolio and how to get the most out of the clinical attachment, but would be here all day otherwise. So I'll just kind of start off with building your portfolio. This is the overview. So why a portfolio matters is what I'm going to try and cover today. Why a portfolio matters, the kind of transition from student to doctor, which I've mentioned, why clinical attachments are important, and the journey after graduation. So Granite will cover a bit about registration with the GMC, and then after this presentation. So what is a strong portfolio? So a strong portfolio, it kind of gives evidence of clinical competence. It's a commitment. It shows your commitment to learning, demonstrates initiative, and it shows your readiness for jobs. So it's kind of just showing off your skills that you've developed throughout your clinical years in university, and then how you can use those skills to benefit the patients that you'll be dealing with in the clinical setting, and how you can contribute to the team. So it's not just evidence, it's not just a CV, it's evidence that you're safe, competent, motivated, and ready to work in a clinical environment. So the different kind of domains that you should include on your CV are the clinical experience which you've gained. So in Bulgaria, because it's the final year, it's the equivalent of an FY1 year, you can talk a bit about what you've done in your different rotations. So in Plovdiv, it was surgery, internal medicine, infectious diseases, and there was one more, pediatrics. And then also you can just talk a bit about what you've done throughout those rotations, the patients that you've dealt with, how you've dealt with them, the kind of presentations that you've seen, whether they be acute or chronic. You can talk a bit about your research and your audits. So this might be a case series or case report, audits, quality improvement projects. So quality improvement projects, it's a project which is done to kind of improve the standard of care, not just for the patients that you're dealing with, but for the patients that other doctors are also dealing with. Teaching, so there's a lot of societies and whatnot. Leadership, whether you're in a leadership role as part of the society, then courses and exams. You can talk about your results, how you've kind of ranked. The courses, there's different websites and different organizations. So for example, the Royal College of Surgeons of Edinburgh, they hold different webinars which are online, and they also hold in-person events which you can attend. They're all certified. You get CPD points. You can also mention those on your portfolio. So it should just include clinical experience, audits, teaching, and courses. And these are pretty much the key areas that employers look at, because at the end of the day, we all graduate with a medical degree, but people kind of want to see, what makes you stand out from someone else. So the priorities in sixth year or in your final years should kind of be to maximize the clinical exposure, just so that you're comfortable, you're confident in dealing with patients, build relationships with seniors. So these could be your professors, your assistant professors, because when you do finish, and you want to transition towards doing a clinical attachment, the human resources or HR department, they're going to kind of ask you for a references, and they'll have to be clinical, so it'll have to be off your professor and the doctors that you've been kind of getting taught by. And then you should also kind of seek feedback actively off your teachers, so you can know where you stand, and then how and where you can improve, and then also document everything. So keep a logbook of what you've done, what you've covered, and that will help you keep track of things which you've done, and then things which must be done to improve yourself. So build exposure, be present in the hospital, build relationships, and then actively seek learning opportunities. So don't just kind of sit around, do what everyone else is doing. Be proactive. Okay. So as I mentioned, keep a logbook, clerk patients independently, don't rely on other people. Obviously teamwork is important, but you should be able to know what you're doing independently. Practice presentations of patients after clerking. So practice SBAR, situation, background, your own kind of assessment, and then recommendations. So for example, 51-year-old male presents with your own assessment and then a recommendation, and then focus on the specialty which you're kind of interested in. Think like a junior doctor rather than a student. So audits and quality improvement projects. So, join existing projects, understand the cycle, the audit cycle, and then aim to complete it and present it, and then document your outcomes. So a quality improvement project is, as I mentioned, is kind of just to improve the standard of care for patients. So for example, improving the time of actual discharge from when a patient is proclaimed as medically fit for discharge to the time they're actually discharged from the ward. Also building teaching experience. So you should teach your juniors, peers, and then kind of get feedback off them, document it all, organize sessions such as this. This would be an example, organize sessions, and then also organize teaching sessions with other societies such as OSCE societies or different societies, and then also ask around in the hospitals, ask professors if you can teach and give presentations. So for example, in sixth year during PEDS rotation, you can kind of ask professors if you're allowed to present on different subjects such as Hirschsprung's disease, etc., and then obviously collect feedback and then reflect on teaching to see where you can improve. It's highly valued, and then even in formal teaching, it counts if you document it and collect feedback. So leadership and initiative. You should be proactive, organize events, lead student groups, show initiative. Don't just sit around. You need to build up a portfolio, and you need to stand out, and also kind of document problem solving. Different courses and certifications which you can do. So you have ALS, BLS, and ATLS. So ALS is kind of advanced life support. It's usually a course which is done after BLS, but you don't have to do BLS if you're doing ALS. BLS is basic life support, so it's like doctors ABC, danger response, airway breathing, circulation. ALS is kind of dealing with the ALS algorithm, which is kind of your shockable rhythms versus your non-shockable rhythm, and you have your advanced trauma life support as well. You have your online courses. So these would be, as I've mentioned, through different societies such as the Royal College of Surgeons of Edinburgh, Royal College of Surgeons of England, etc. If you go on their website, you can find different opportunities and they'll also have the courses which you can attend. They're usually free. Some you have to pay for, and they'll also give you a certificate and CPD points, which are career progression points. So it's all documented for you. And then also attend conferences. If you're doing all of this, it shows your willingness and your initiative to kind of develop yourself, and it'll help your portfolio stand out. And even conferences, they're all kind of advertised on these colleges' websites. So conferences in psychiatry, surgery, and then the certificates add value. But of course, don't just do these things to kind of, get a certificate or for the sake of getting a certificate. You want to do it for your own personal gain, for like learning, and reflect on what you kind of got out of these different experiences, how it's added to your skills and whatnot. It's not just for the sake of saying, oh, I've done this is what it is. You want to be able to detail and kind of outline what you got out of doing the courses. And preparing for graduation. So throughout 6th year, you want to kind of keep updating your CV. You want to keep it neat and professional, prepare the evidence, and then also start kind of identifying where you want to go and what route you want to go down. And so for clinical attachments, you kind of want to start searching for opportunities early on. Don't just think, oh, I'll deal with it later. I'll deal with it. Then when the time comes, you want to start looking early, 2 or 3 months early, because otherwise it takes a while to also, before kind of between the time where you've found someone who's willing to take you on for an attachment and actually starting the attachment can be anywhere between 2 or 3 months. So you want to start before graduating, so that as soon as you've graduated, you can hit the road running. So what is a clinical attachment? So it's a observership in the hospital. You go in and you see how the system runs. So it depends on which specialty you're in. So I did mine in orthopedics. So I'd go in at 9 o'clock. There'd be a ward round this is where you kind of follow the consultant around. He'll deal with the different patients, and then he'll help you formulate a plan. You make a jobs list, etc. And then throughout the day, you'll deal with the jobs. It gives you exposure to the different healthcare system, and because as an IMG, it's very different when you come from, say, for example, Bulgaria, and then you're coming to the NHS, and then you have to deal with all these different. It's very different, and it's unpaid. but it is valuable because of you gaining experience and it helps you build confidence dealing with patients. It helps you understand the NHS system, develops your communication skills, and it allows for networking. Networking is crucial because you're going to need consultant references, and NHS references are more highly regarded than, say, for example, the references which you've got from your university abroad, because it kind of shows that, okay, look, there's an individual and he's gone out of his way, he's done an attachment, he understands the system, and ultimately improves your chances of securing a job. So there's different routes after kind of getting these references. You can speak to the HR, and there's more internal vacancies than there are external. So if you can try and find out if there's any openings. You can try and join the bank, the hospital bank, and then pick up bank shifts. But all of this, you have to get approval of the consultant who supervised your clinical attachment. So how to find attachments? Email the consultants directly. If you go on, the trust website, you can kind of go onto the directory, and there'll be different consultants you can email within the different departments that you're interested in. You can also use platforms such as LinkedIn. LinkedIn's a bit more personal because you can make your own account and kind of show off what you've already done throughout uni. The consultants can have a look before replying to you. I'd say it's more, there's a higher likelihood that you'll find an opportunity through LinkedIn rather than just emailing consultants directly. And I found mine through LinkedIn. So I just messaged a consultant and I said, hey, I am a sixth year studying at Plovdiv Medical University. This is what I'm interested in. Are there any opportunities for me to undergo a clinical attachment? And then the consultant kind of got back to me, said, send me your CV. And this is why building your portfolio is important, because they will always ask you to send a CV. Then they'll kind of check it, approve it, and then send it to HR. And this is why I was saying you should be proactive and start looking for attachments early, because it can take 2 to 3 months before all the necessary recruitment checks are complete. And persistence is key. You're not just going to get it, you won't get it on the first message. You have to find other consultants that are kind of willing to take you on, because some that they're busy, and then with some there's not enough. They don't want to overcrowd the meeting rooms and whatnot. So you have a clear subject line. So, for example, opportunity for clinical attachment, attach your CV, brief introduction, like I said, and then state the availability. And CV, keep it concise, highlight any clinical experience, as I've mentioned, include the audits and teaching, and keep it professional. Don't add anything unnecessary. You want to keep it straight to the point so they can quickly grasp an understanding, because consultants, they don't have time, just to look through CVs and whatnot. During your attachment, this is the important part. So during your attachment, be punctual and professional. Don't just on one day go in at a certain time and then the next day go in at a different time. You want to kind of show that you're reliable, because no one's going to want someone to join the team when you're just, doing your own thing. Be proactive, engage with the team, ask questions. This is important. You want to show a willingness to understand the system, how things work, and show enthusiasm, most importantly. Don't just sit there looking at your clock and thinking, okay, when HR sent me this clinical attachment contract, it said I have to be here from 9 to 5. So I'm just going to be here from 9 to 5 and not do anything within the 9 to 5. You're not doing an attachment for the sake of doing an attachment. You're doing an attachment for the sake of understanding what's actually going on, how the NHS system runs, how the department that you're in works, patient engagement. You're trying to build your skills. You're not doing it just for the sake of certification. You want to be able to speak about what you did during a clinical attachment. For example, if an opportunity does arise and then they ask you, okay, so you've said you've done this attachment, what did you do during the attachment? You're not just going to say, oh, I sat there from 9 till 5. So be punctual, be professional, look the part, play the part, be proactive, and ask around, ask for opportunities. Ask if you can do anything else, or if you can do more, try and do more. You just kind of have to be a yes man. If someone says to you, do something, then do it. Don't say, oh no, I want to sit around, do nothing. What else during attachment? So maximize your learning. If you show that you're engaged and you want to help, the staff will also help you. So if you ask your consultant or the F1 doctors or the F2 doctor if you can shadow someone who's on call, just so you can kind of gauge an understanding or an insight into the difference between the job of an on-call doctor versus kind of a ward-based role. You should ask around and then clerk patients. Some trusts during a clinical attachment they don't let you. This is what I've heard, but at the trust that I did mine at, they allowed me to do all sorts of things. You just have to ask around, and obviously it helps you build your independence, helps you understand the system, because there's different system for clerking patients. In abroad, the students and the professors, they'll just come up to you and say, okay, go and clerk this patient. Whereas in the NHS, there's a whole process. You have to have a history sheet and whatnot. Then you have to document it afterwards. Practice presentations. So weekly, in the trust that I did my attachment in, weekly there'd be sort of CAPD teaching sessions, which are sort of departmental teaching sessions, which would run weekly. And so I asked the organizer if I could sort of run a teaching presentation, and he allowed me to. He didn't say, no, you can't do this. So you just have to ask around, kind of be proactive, seek as many opportunities as you can so you can build confidence, build your skills, build your own kind of independence. And then the consultant will see that you're reliable, hardworking, willing to learn, and then you'll get a strong reference as well. And then also observe the decision making during ward rounds so you can kind of gauge an understanding of how the different patients are managed. So you can understand the different dynamics, and then reflect daily or even weekly. So what I did, I kind of kept a weekly logbook of all the things which I did, and then I'd share it with the consultant just so that he's, I'm keeping him up to date with what I've been doing, what I haven't been doing. And then be vocal as well. If you feel like you're not getting enough support, ask for it. Don't just sit there, think, okay, I'm here now. I'm doing a clinical attachment in quotation marks, and think, okay, I can say I've done an attachment and not get anything out of it. You should be vocal and ask for what you want so that you can do what you want to do, and then build the skills that you need, right? You don't just want to sit there feeling lost, kind of hopeless, because there's a spectrum. Some people do an attachment and they get everything that they want out of it, and then on the other end of the spectrum, some people do an attachment and you kind of ask them what they've been doing, and they'll say, oh, I've just been sitting around doing nothing. They don't let me do anything. It's like I said, if you ask consultants, or even the nurses are very helpful. if you ask consultants, doctors, FY1 doctors, FY2 doctors, nurses for opportunities and whatnot, they will help you. And there's also FY1 and FY2 teaching sessions. They're great for networking because you can speak to the other FY1, FY2 doctors. They're kind of at a similar level to you. You can find out, where you want to improve to get to the same level as the level of a graduate from the UK, etc. You want to be at the same level, and then they're great for networking as well because weekly it'll be a different consultant or a different doctor teaching, so you can speak to them as well, ask them for different opportunities. So essentially, clinical attachment, it's not just for building your skills and getting an insight into the NHS system. You want to build, a portfolio which demonstrates that you can clerk patients, you can do, SBAR handovers and whatnot, observe, you can sort of demonstrate good decision-making skills. And then also on top of that, network, meet different doctors who can provide strong references, and and then you can progress from the clinical attachment smoothly. You don't just want to be sitting in the hospital feeling a bit lost. So yeah, as I said, building relationships, engage with the team, speak to different people, build positive relationships. You don't want to set an impression where you go in and people look at you and think, okay, what's this guy doing here? You want them to come up to you. You want them to say, you want to come across as reliable so that they can come to you with tasks where they feel like you're ineffective. You can deal with them effectively so they can offload them to you, and then they can go and do other things rather than you just going there, sitting there, and they look at you and, I don't really want this guy to do this for me because he's not reliable, right? So be helpful, show interest, and then of course stay in touch as well. It's like building a normal relationship, making friends, etc., except in a professional manner. Getting references right. So you don't want to turn up on the first day of an attachment. It might sound a bit obvious, but you don't want to turn up on the first day of an attachment and say, look, I'm looking for a job, this is what I want, can you do this for me? You want to spend 1 or 2 weeks, allow them to get to know you a bit, show them that you're committed, reliable, show you have good communication, right? Because recently on the attachment that I'm on now, someone kind of just came in on the first day, and you don't want to do this, but he just came in on the first day and said, okay, look, I've been kind of doing attachments back and forth for a year, nothing's come out of them, right? And he told all of this to the consultant straight up, and he said, the consultant kind of just looked at him and said, all right, okay, got his story. And the person who was asking the consultant for a job and for something, he left, and then the consultant said to the whole room, oh yeah, I didn't like that, I didn't like his body manner, he was too upfront, you should allow us to get to know you first. We're willing to help you, just don't be so upfront about it. Let us understand you, let us show us that you're reliable and committed. You can't just come in on the first day and say, oh, this is what I want, right? So you should request it at the end, and they will usually give it to you. Just don't be like, don't be stuck up about it, and provide your CV. And then also at the end of the attachment, if there are no internal vacancies, you can use the references for locum agencies, and then also bank, etc. After the attachment, so update your CV. This is kind of just reflection, what you did during the attachment, how I kind of mentioned how it's helped you develop your skills as compared to the time you were a medical student versus as a doctor. and then start applying for roles. So you can speak to the consultant. Of course, after you've built a positive relationship, you can speak to the consultant, ask them if there's any opportunities available. Because at the end of the day, the consultant might know different people. For example, he might know a director, or he might know a deputy medical director in a different trust, or a clinical lead. And then he can forward your CV on to them, and then he might be able to help you secure kind of a non-training post. And even with a non-training post, you can progress, because it's a paid role. You can progress, you can get a CREST form signed off, and then you would be allowed to sort of sit the MRSA exam and then apply for specialty. But of course, it's one step at a time. So that the kind of route after graduation is, or from sixth year, you want to start building a strong portfolio so that you can get an attachment. You have a consultant who can see your portfolio at the end of medical school, and he's actually willing to have you on because you can see that you've shown initiative and you've been proactive throughout your time or throughout your final years of medical school, so that he can see that you would be kind of useful as an addition, as a clinical attaché to the team. And then you want to show them during your attachment that you're still proactive, you're still maintaining the same initiative you had during final year, and you want to continue and build up and carry on building your skills, and then also plan your next steps. But after you've built a strong relationship with the consultant, they will help you. And then, as I mentioned, common mistakes: passive attitude. You don't want to just go there, sit around, not get anything out of it. Poor communication. Be vocal. Let them know. You are there. If you're just silent, you're going to be that person that's just in the corner. That's what you'll be known as. That person that's in the corner, doesn't say much, doesn't help, doesn't do anything. Not document your experience. And then also prepare. So, if you're going into if you're going into a department or a specialty which you're interested in, read up on that specialty, because sometimes the consultants during your attachment, they might ask you some questions on a different kind of condition. And if you don't know, what you're talking about, then, it's a bad look, because on your CV, you might have said such and such, that you've done this, that you've done that. But whereas in person, they're asking you questions and you can't kind of demonstrate the same skills that you've noted down on your CV. So they will be able to tell, whether the CV actually matches who you truly are, right? And one more thing, so like passive attitude. When you're there will be opportunities when you're on the attachment, there will be opportunities where, for example, FY1 or FY2 has to go for a teaching session, and some discharge summaries have to be completed, or some form of documentation has to be done. You can ask them and say, hey, look, I can help you with this. And then when you're back, just check through it, run through it, just to see if it's okay. And they will be more than happy to do it. No one's going to say no, if you ask them to help with some documentation or anything. Be reliable, be helpful. And then the different routes that you can kind of take are, trust grade roles, FY2 standalone, and you can prepare for interviews. Ask the FY1, FY2 doctors, especially the FY2 doctors, because they'll also be they'll have experience with preparation for interviews. And then practice scenarios, keep your knowledge up to date. You don't just want to, you don't want to finish medical school, lose everything that you've studied 6 years for, and then go into an attachment or go into a work and then have people look at you and think, oh, this, you're unreliable, right? You want to be on top of your game. And some final advice is just, I hope I've been thorough, and I've kind of, it might be a bit harrowing, but I hope I've also kind of inspired, to keep going and be motivated with developing your portfolio, finding an attachment. But yeah, be consistent, stay motivated. Don't just kind of, after one or two messages or emails to consultants and no response, don't just stop. And then even throughout an attachment, after 1 week, you might think, oh, I'm not getting paid, but I'm doing all of this stuff. You might think, oh, nothing's going to come out of it. You have to keep on going, stay motivated. You have to let them see that you're willing to, you show willingness, right? You have to let them see that you're contributing, that you're doing things, you're helping the trust, you're contributing to the department, whether it be through communicating with patients or whether it be through audits or quality improvement projects. And you want to keep improving not only for yourself, but for the patients that you will be helping throughout the rest of your career. And as with everything, opportunities, they come with effort. So you have to do your due diligence, right? You can't just say, oh, I've done this, but I didn't do it, full-heartedly. So I nothing came out of it. You want to say that you did something full-heartedly, and then if something comes, something comes. If it doesn't, you can say, okay, at least I did it with, full effort and got solid references, and I can use these references in the future, right? And that's all from me.
Thank you, Talha. So
Listening.
I can see on the chat that Zaman, you asked a couple of questions. So we're going to do a Q&A right at the end. And just before I go into the next section regarding the application process for the GMC, I just want to highlight what Talha said as well. I think it's very important that when you do an attachment, that you show that you are the right candidate to work in the NHS, and you prove that. And just waiting around to be told to do things is not going to get you anywhere. And from my experience in A&E, I can tell you that the more you try to show yourself and see patients and show that you're a team player, then people will respect you more rather than if you just wait around to be told what to do. But at the end, we'll answer any questions you have, and we will continue now.
We've got 15 minutes, right?
Yeah, so we can take a break for about 10 minutes, guys, if you want, and then around just let's say 10 to 4, so in about 7 minutes, we'll start again, and I'll go through the next section. Okay. Okay, so I'm going to continue now and talk you through the steps that you need to go through in order to secure your GMC registration and some of the documents and things you'll need. So basically, if you want to join the UK workforce, you obviously need to apply for a license with the General Medical Council. This is the GMC. They regulate activities that all doctors do in the UK. They're responsible for giving you the license to practice, doing all the background checks, and they oversee pretty much everything related to what doctors do in the UK. So in order to obtain this, you have to submit some documents to different places to get things verified. And depending where you've graduated from, and also your citizenship, you may need a visa. So if you're British, of course, that doesn't apply to you. So for those of you who are not British or may not have the ability to work here, then that's an additional step you need to look into depending what country you are coming from. So we have different types of GMC registration. You have a provisional registration, which means that you've registered, but you're not yet licensed to practice. But let's say you're on the pre-register list. You have a full registration. So this means that you have been given a full license to practice in the UK, and you are a doctor that basically can start working. Or, of course, it won't apply to a lot of you who have graduated now, but those who are specialists or GPs will also have a separate section with regards to their registration. There's obviously different routes that different places take, depending where you've come from, which medical schools you come from regarding what steps you need. So for those of you graduating outside of the EU, for example, will probably have to sit the UKMLA, formerly PLAB. And any of you who are coming from EU universities, like Bulgaria, for instance, obviously will not have to do that, and your route is a little bit different. So as I mentioned, I'm going to focus on the process for EU graduates, the registration process, the types of documents that you require, and where they need to be sent off to, and the sort of timelines it will take before everything gets done. So firstly, before anything starts with regards to your registration, you need to have something stating that you've completed your medical education. So this could be your actual diploma, which you get in your graduation ceremony, or it could be a provisional diploma letter. So this provisional diploma letter is a letter that's given to you when you completed your internship year and you've passed all your exams, which basically states you've completed your medical education and you are going to be graduating at a later date, whenever your final diploma is ready. Another document you're going to need, and by the way, this is pretty much standard across wherever you graduated from, is an internship document. This means that you need to have some sort of letter or document that states that you've completed an internship, the subjects you've done this in, and how long you've spent in each rotation. So for those of you in Bulgaria, for example, that would be your 6th year, so the internship year after you've completed your medical studies, which basically equates to F1 in the UK. English test requirements, so proficiency of English, OET and IELTS, so I'll go more into that in a moment. And good standing, I'll clarify what that means. It doesn't apply to all of us, and there's some technicalities related to that, so I'll get into that. So the first thing is proof of English proficiency. There is 2 different tests that you can do to prove that you have sufficient English to work in the UK. The first is the occupational English test. This is OET. And the second is IELTS. So OET is a test that can be done at home. You can do it online at home. You can do it online in a test center. For those of you here in the UK who may have done your driving theory test in a test center, it's that sort of vibe. So you go into a center, you have computers, there's obviously invigilators overseeing you, and you do your test. And you can also go to a test center and do it on paper if you prefer that over doing it on the computer. When you do the OET test, there is different subsections to it. There's a listening section, reading section, writing, and you have to score a minimum of a B grade in each section. So I think with the number score that they give, that's about 350. And that's in order for you to be able to get your GMC registration. If you score below B in even one section, you'll have to retake that. When you get your OET results, you have to share this with the GMC. So when you create an account with OET, it will ask you if you want to share this with any organization. So you need to put General Medical Council. There'll be an option on the website when you apply to make sure that this result is shared with them. Another thing that's important is when you pass the exam, you'll be given a specific candidate number. So the certificate which shows your candidate number is essential because when you apply for the GMC, you have to put your candidate number from the OET onto the form so that they can check your results and prove that you have got adequate scoring to be able to work in the UK. On the other hand, you can also do IELTS. IELTS has more components to it. It's a more standard English test. It has some people find IELTS easier, some people find OET easier. I personally did OET. IELTS as well can be done in person or online, and it's an exam that can be done for various specialities. It's not just medicine. So IELTS does exams for English for all sorts of disciplines, but for the medical aspect of it, you have to do the academic version of the test. Now, you get marked on each section in IELTS. In order to be able to apply for a GMC license, you need to have a minimum of 7 in each section. That equates to about 7.5 overall. That's just to get the standard of, that's just to prove that you have the standard of English to work here. And you need to have a report. Again, that needs to be shared with the GMC, and you'll be asked for any candidate numbers from that as well, which need to be placed on the form. Now, another important thing is some countries, even EU, non-EU countries, may be listed as having English sufficient for, maybe sufficient for proof of English. So especially countries that have English as their first language or the native language is English, then you may not be required to sit these tests. So you need to check, depending what country you graduated from, whether or not that applies to you. For those of you coming from the EU, it's absolutely necessary. Second thing you're going to need is your medical diploma or provisional diploma letter. So as I've said, when you complete your internship year, that's your final year that you've been rotating through different specialties, gaining experience and technically working, your university will provide you with a letter stating that you have conducted such placements. And this will highlight as well that you've completed your medical studies. Another important aspect of it is the good standing. So this letter usually should say that you've not been subject to any medical negligence, investigations, and things like that, which would be of concern, because obviously the GMC need to know that you have competencies and that there's nothing that would compromise you if you were to join the UK workforce. Now, a lot of the documents you might get will not be in English, so it's very important that these are translated, certified, and notarized. So that means you need to go to a certified translation center, make sure it gets notarized so it's legally binding, and this has to be stamped to show that it's an official document. As I said earlier, you do not need your final medical diploma to apply for the GMC. It's absolutely not necessary. This letter that the university will give to you, if they give a letter saying that you have completed your medical studies, that you have good standing and you have no investigations or anything like that, and you have completed an internship year, and that you are due to graduate in a few months with a diploma, that is sufficient, because technically all you're waiting for is your final documents. So you've actually completed the entire course. So the medical provisional diploma letter is sufficient. Alternatively, if you want to wait for your diploma, you can do that too. Sometimes the diploma takes a couple months. So obviously, for us in Plovdiv, for example, we finished our internship in September last year, and we didn't graduate until December. But as soon as we completed our internship, we were provided with a provisional diploma letter, and this letter was sufficient for us to start our GMC application. Make sure you translate these again. So same as with any document, make sure they're translated with certified translation, make sure you notarize them, and also make sure they're stamped, obviously to make them official. Otherwise, you're going to have a problem legitimizing them going forward. Now, once you have this diploma letter, or once you have your diploma, you need to verify this. So before the GMC process even starts, you need to go through an organization called ECFMG, which actually works in the US for those who are doing USMLE, but they also have a subsection called EPIC, which is responsible for legitimizing and verifying all the documents that we submit to prove that we've completed our medical education. So if you focus on the first box at the top, provisional registration or full registration, that will apply to anyone due to graduate. So that can be the primary medical qualification. So this would be the actual diploma, or an accompanying certificate, which I said is the pre-diploma. So either one of those is enough. When you submit documents to EPIC, you will need to have the original scanned and sent to them on their website, and also the translated copy. So the link that I've put here, you can take a photo of it if you want. There'll be more information on there, which will be helpful for you. And this will give you the instructions that you need to follow in order to do this correctly, because obviously it's very easy to make mistakes. So I'm giving you an overview of the steps you need to take, but read into it more because it may differ from certain countries. But the general picture with EPIC is that they are responsible for verifying your degree. Before you start the process with EPIC, on their website, it'll ask you to make an account with MyIntHealth. So MyIntHealth is the platform on EPIC, which is where you will be uploading your documents. So that's the very first stage. You need to actually make an account with them, and that in itself can take a while because they may ask for some identification. You need to send proof of who you are. They'll ask you to do a video call with them with a lawyer present to confirm that this is who you are and that you're not falsifying anyone's identity. And when you've established the account, then you start the process of verifying with EPIC through MyIntHealth. So that's very important. So once you've established that account, that's when you're going to submit either your pre-diploma or your official diploma. And you need to make sure that you send both the original, so pictures as a PDF of the original, and also pictures of the pre-diploma, or of the translated document, sorry, okay? So again, either pre-diploma or diploma will be enough here. Once you've completed everything with EPIC and they've verified this, by the way, the EPIC process, all of this can take about 5 to 6 weeks. Then they'll provide you with a MyIntHealth ID number. This number is crucial because when you do your GMC application, it will ask for this number. And this number is what the GMC will use to prove that you have a verified medical degree. So if you want, you can take a picture of that URL as well and have a look at it in your own time. And you can establish that account now. Even if you haven't graduated, you can start the process to set that up. It'll ask you for where you graduated from and all that sort of thing. So it's just some admin things that you can do beforehand to speed up the process. Internship documents. So as I said earlier, when you've completed your final year of med school, for some of you, maybe you do an internship year after your final year of med school, then you need to make sure that you have a document stating which disciplines you've rotated through and how long for. For example, as Talha mentioned in his talk, in Plovdiv, in Bulgaria, we had 3 months of surgery, 3 months in internal medicine, and then we had separate rotations in infectious diseases, public health, and things like this. So make sure that you have a document that states what you've rotated in, how long you've rotated, and how many hours you spent doing it in total. If this is not in English, again, make sure that it's translated and stamped. It's absolutely important that every document you have that is not in English has to be translated. So this document for the internship is not required by EPIC. The only document that EPIC requires is your pre-diploma and diploma, either or, pre-diploma or diploma. The internship document will be required at a later stage when you start your GMC application. So regarding the GMC license, if you have a look at the link I've sent at the top, you can take a picture of that as well. This will give you all the instructions required to be able to obtain your GMC license. So it highlights everything that you need to do, everything that you need to prepare. It'll give you some guidance on timelines for how long things may take, which can vary depending on how many applicants have applied for the GMC at that given moment. And it will give you some information on cost, etc. So do familiarize yourself with that. What I'm going to do now is break down these points for you, the ones that are that we are able to do so, and I'll try and make it as clear as I can for you. So the first point refers to the evidence of primary medical qualification. So even though you've verified everything through EPIC, when you submit your GMC application, you will still need to include your diploma, some PDF including your diploma or pre-diploma letter, so that there is evidence that you have a medical qualification. And this needs to be in English, okay? So this certificate will show when you've completed, so that pre-diploma letter or diploma will show when you completed your medical studies, when the last exam date you took was, and if you've conducted an internship or not. So all of that will be provided on that document that the university may provide to you. So it's very important that if you're going to apply before your diploma arrives, that pre-diploma letter includes everything related to you completing med school and that you've conducted all the required things. So final assessments or exams and when you passed it. For example, if you had your last ever medical school exam during your internship, if you had an assessment during your internship and the last one you ever took was on the 5th of October, for example, then you have to say, okay, that letter needs to say that you completed your last exam on the 5th of October, okay? So it's very important that that's highlighted. Again, make sure that you translate these documents because it's unlikely they're going to be in English. The second thing is the evidence of internship, okay? So that document that I mentioned regarding proof that you've conducted an internship must be provided to the GMC when you apply. So as you can see at the top, it says you must have done at least 12 months continuous medical practice in an approved training hospital, in a public hospital, either immediately before or after you've graduated. So either this is a 1-year internship that you've done just before graduating or a 1-year internship after. So for example, in the UK, when medical students graduate, they do like 5 years of med school, for example, and then they do F1. So that F1 year is like an internship year for them, but it's not incorporated into their medical school because they only get their full GMC when they finish that F1. But in Bulgaria, for example, and in most of Europe, you have a 6th year, which counts as that internship year, and only after that you graduate. So that's the difference there. So make sure that you have a letter or a document that states you've completed such an internship program, and it highlights everything you've done. So as you see, there is requirements. 3 months in medicine, this means internal medicine, for example, cardiology, gastroenterology, nephrology, all of those sort of subjects, and 3 months in a surgical specialty, okay? Plus anything else that you may have done across that year. So this is really important. And again, it needs to give the disciplines you've rotated for, the periods of time that you rotated for, so from what date to what date, and also the hours, etc., that you've been there in total. That proof of English proficiency again, so I put the same slide again, so familiarize yourself with this. The numbers or things that you get from the certificate for OET and IELTS is necessary for the final form when you apply for your license. So passport, another important thing. So When you submit your application, you'll be required to scan a photo of your passport. So the inside containing your details. This is absolutely essential. This is obviously, again, to prove your identification, who you are, and at a later date, the GMC will send you a link to prove your identity. And that's one of the final stages in the application process. If you don't have a passport, you can use a national identity card. But again, the identity card must show your face and state, obviously, where you are from. So proof of good standing, I want to just go through this and clarify what this actually means. So the letter that the university provide you when you graduate, which is the pre-diploma letter, may include some information stating that you have not been subject to any convictions related to like medical negligence and things like this. So it needs to state something like that. I know the ones, if you graduate from Plovdiv, then you will get that. I don't know what it's like for other universities in Bulgaria and the EU, but I'm assuming that they will have some sort of sentence stating that you have not been subject to anything. So that's really important. Additionally, if we have anyone here who is thinking of coming to work in the UK, who's been working for a few years in another country, you'll be required to declare which health authority you are registered to in which country, and you'll be required to obtain some sort of proof from them that shows that you were not subject to any negligence cases. So this is very important because otherwise you have a very high chance of your license being rejected because of any incompetencies that they may assume based off that. So that's really important as well. Now, your activities for the last 5 years. So if you have been a doctor for the last 5 years, then obviously you have to highlight everything that you've done, any gaps in your employment, why you've had gaps in your employment, what kind of jobs you've worked, the experiences you've had, and basically everything you've done postgraduate. For those of you who are still in med school, particularly those in 6th year, you can include any clinical attachments you've done, so you can write those down, and even your foundation, your internship year can be included in this. But obviously, if you have no work history, then you just need to specify that you haven't worked. Basically, you just need to answer something on this. Even if you've not done anything, you need to specify you've not done anything. So they know you've not done anything. Because if you just leave this section out, then your application will not be accepted. So if you've not been working, you've not done anything, that's not a problem. You just need to provide information so that they know that you've not done that. Declaration of fitness to practice. So obviously, before you come to work, it's very important that the GMC are up to date with anything that could be of compromise to yourself, whether that's a health condition, whether it's a lawsuit or action taken against you from an employer or a medical school, because all of these things, they may have a case-by-case basis that they look into, and they need to determine whether you are fit to practice in the UK. Obviously, lots of laws and a lot of things that can complicate things in the UK. So declaring these things is really important to ensure that you don't have any problems going forward and that you are able to get your license and apply. So again, make sure you translate any documents that are not English into English. So please make sure that you get them certified and stamps and check over them. I know that a lot of my friends in Bulgaria, after we graduated, quite a few of us had some mistakes on our documents, which we asked them to rectify. So just ensure that you check through everything, that it's written correctly, spellings are correct, dates are correct. The internship document, make sure the dates are correct on that, the hours, the spelling of the different disciplines, every little thing, make sure you check it and that it's done correctly. Otherwise, again, something as simple as that could be a problem for you. So there's different ways for you to apply for your GMC license. So you can do it through post, where you basically fill the application form on paper and then you send copies of the documents necessary to them. The easier way is you email them. So that's what I did. You can download a PDF. You can download a PDF of the form necessary, and you fill up all the information on there. And in the same PDF document, you include the pictures of your passport, of your internship document, of your pre-diploma or diploma, etc. So that's really important. But before you do anything, you have to go on the GMC website and you need to make an account with GMC Online. So if you guys search GMC Online, it'll bring you to a website which will ask you to verify some details. So they'll ask you for your name, the institution that you've graduated from, etc., etc. And then you'll be given a GMC reference number, which later down the line, when you finally get your license, will be your GMC license number. So you can apply through GMC Online depending where you've graduated from. So there is a section on the GMC website that you can directly apply from. But for most EU graduates, if not all, you won't be able to use the GMC Online platform to apply, but you still need to make an account with GMC Online. So make sure that you have a note of your reference number. This is really important, and it's important for you as well because that will ultimately be your personal number. So with regards to the registration process with the GMC, once you've filled out this form, you can email it to the email that I've put up there. So make a note of this email. This email will be where you send your application to. You'll then get an automated email saying, thank you for applying, and we'll get back to you. And if they do require any additional information, they will reach out to you and they will ask you to edit something. Or if you've missed a question in the form, they'll ask you to please fill this in and send it back to us, etc. So if you have a PDF of this form and you include all those pictures, that's enough. So for those of you graduating from the EU, I'm not sure if it's the same for any non-EU graduates. You need to fill out the IMG 23 application form. So make sure that you find that form and you fill it in. So you can obviously do this on paper and then post it out to them. Or what I did was I downloaded it onto a PDF and I filled it out on my iPad. So if you have an iPad or something that you can write on like that, then you can just fill it in and send it off to them. So thank you for listening. That is our email at the bottom. If any of you want to reach out to us to run any talks or workshops going forward, Medipath International, we're a non-profit organization that does workshops in the UK, in EU, and in the US, aiming to bridge the gap between medicine and education in medicine, let's say, and medicine. So if you have any ideas or you want us to do some sessions, then do collab with us on there. Before we finish this presentation, this QR code, please do scan it and give us some feedback. It helps us a lot to improve going forward, but also it confirms your attendance to this. You will be given an attendance certificate by courier book by filling this in. So please do that. I'll give you all a few moments now to just scan this and fill it in. It confirms your attendance. Like I said, you will get a certificate of attendance by filling this in. So I'll just give you a few minutes to do that. And then we'll be back around 4:30 and we can do a Q&A for you guys and anything else that you want to ask us. Okay, so now that you've had some time to fill that in, I hope, so please make sure that you do that so you get your attendance. We'll do a quick Q&A with you guys as long as you need. Any questions you have, please do ask us and we'll be more than happy to answer them to the best of our ability. So feel free to ask us whatever you want. So let me just go through some of the questions that I've seen on the chat. So Zaman asked us about dress codes for attachments. Do we need to wear scrubs or casual smart wear? So obviously different trusts will have different guidelines on policy for their uniforms. So, and also it depends on the department. So for example, in A&E, there's not usually any F1s. So F2s tend to wear, when the trust I'm in is like green scrubs. Locum doctors tend to wear blue scrubs, and it really depends. So just speak with the consultants and whoever's in charge, and they'll tell you what you need to wear. But it will probably most likely be some sort of scrubs that you need to wear. And then it says, shall we hand in our CV to the consultant at the end of the attachment, or should we bring a hard copy via email? So when you apply for your attachment, they'll most likely ask you for a CV. There's no harm in giving them a CV at the very end as well. So obviously when they write your reference, they have as much information about you as they can, and also regarding what you've done during that attachment, so that you're best equipped to get a very good reference at the end of it. Talha, anything you want to add there? Okay. And another question that I see is, how do I get my revalidation for GMC? Also, how do I find a designated body? So basically, the revalidation process occurs every few years, and it's basically to prove, and even every year, to prove what you've done in the last year, what kind of work you've been doing. So they have record that you've been actively working in practice, or basically what you've been doing. So that would be done through the GMC. They'll give you a reminder email when the time comes. And how do I find a designated body? So basically, when you are employed by a trust, it will show up on your GMC profile that this is the trust that you are designated to. So that is what you would be referring to regarding that. So the section on designated body would be the trust that you are employed by. And do we apply for GMC, full GMC registration? Yes. So depending where you're coming from, for example, in my experience from Bulgaria, and pretty much for most every EU graduate, you would be applying for your full GMC registration. So that means when you've done all the steps that I mentioned, you would be given your full GMC license with the right to practice in the UK. Another question I see is, any advice on where to find clinical attachments? Which website did you use? So sometimes, if you look on NHS jobs and on track, you can see attachments listed there that you can apply for. A lot of the time, however, you can look at individual hospitals. Some hospitals advertise attachments, some don't. But your best option is to be proactive and email consultants and ask them if you can participate in an attachment. If they agree to take you on, then you have to go through usually HR or the education department in the hospital, and they can then tell you when they have availability, and they can guide you through that process when the time comes. The documents that you're going to need, which often includes your CV, a DBS check, and also a health certificate. So they'll check, that you have the vaccinations that you need, etc. Regarding that. Can a locum agency provide revalidation? Yeah, so it doesn't matter if you're working, even if you're working as a locum privately, then you can be revalidated based on that. How long do we need to do an attachment for? So usually you need at least 6 months of experience. So most of the jobs that you will see advertised require about 6 months of experience. So most of the jobs that we would probably be eligible to apply for is the odd trust grade F1 job, or let's say an SHO job within a trust. And this is like F2. And basically, if you have 6 months experience, it increases your chances. So 6 months is, let's say, the bare minimum. However, it doesn't guarantee anything because some trusts don't accept clinical attachments as experience, some do. So that is where some hiccups come about when it comes to applying for jobs. But like I said, like Talha said, when you're on an attachment, show yourself, be proactive, and give them a reason to employ you. And sometimes they can, sometimes they can't. It depends. If the trust has no openings and they can't hire anyone at that moment in time, then they may be able to give you an insight as to when jobs may be opening in the future. So at least you built that rapport with some consultants or doctors. You've networked with consultants and doctors, and then you have a higher chance of obtaining that in the future. So, and to be fair, it's not even mandatory to do an attachment. Sometimes, if you somehow get a job beforehand, then that's fine. So some people do that. It's very, very, very rare because right now, as you know, in the UK, there is a crisis, let's say a crisis with regards to applying for specialty training. So because a lot of people can't get into training for their specialties, there is now way too many SHOs. So as a result, now a lot of trusts have frozen jobs. So there's not a lot of jobs on offer. So you need to keep checking, because when the time comes that some F2s and SHOs do move on to work in specialty training, if they get in, then there may be some job openings. So you just need to be basically on the ball, and you keep looking and checking for anything that comes up, basically. When is the best time to do the English proficiency test? The best time is during your 6th year. If you can do it in the summer, so if any of you are graduating at the end of this year, do it this summer. Get it over and done with, because when you pass the English proficiency test, they last for about 2 years. So it's best to do it earlier. That's one thing out the way, one stress out the way, and at least now you're in a position where you can start thinking about your application. How has the new prioritization bill affected EU IMGs? So I'm not going to lie to you guys, because I think we need to be honest with each other about the whole situation. So the new prioritization bill was made officially as a law-abiding thing, let's say, earlier this year, which means that anyone who's joined the NHS or joined the GMC after March 2025 will no longer be prioritized for specialty training. So that means we are at a big disadvantage when it comes to progressing in the UK, unfortunately, but that's just how it is. That is the current situation here. So getting that first job eventually will probably come to us. However, the chances of progressing are diminished because of that reason. However, there are, this year they did include British nationals as part of the prioritization to an extent. So if you are a British national coming from overseas, you may have an advantage. However, the guidelines and the requirements for training applications for next year haven't yet been released. So they should be released by the end of the year. And it will clarify whether or not British IMGs would be included in the prioritization. So that is something that is being considered. However, as it stands, those who have graduated in the UK have an advantage to progress into specialty training, because we wouldn't technically be able to apply in the first round of applications. How does one get a trust grade F1 job? So different ways. Obviously, if you've gone on an attachment and you've shown yourself well, and they have an ability to open a job up for you, if it's financially possible, etc., then they would be able to maybe make that happen for you. Alternatively, if you look on NHS jobs, which is where all the jobs are shown, you may be able to find the odd trust grade F1 job. However, most of the jobs are Most of the jobs that you see are F2 or SHO trust grade jobs. Do we apply through Oriel? So when you graduate, there's different routes you can take. One option is that you apply for trust grade roles and you work for 3 months or more, and you can then get a crest form. Alternatively, you can go through the F2 standalone program. You need to check the UK FPO, so Foundation Program website, for the requirements for being able to apply for Foundation Standalone. And there is requirements according to your English test. So the English, the scores that I mentioned earlier for IELTS and OET apply for your ability to join the GMC. However, the requirements for F2 Standalone are higher. So you need to have a higher score for English proficiency. If you are doing the F2 standalone program, then you can apply through Oriel because you'd be officially on the foundation program. For most of us, though, when you apply for jobs, if you are not in the standalone pathway, then you would have to apply directly through NHS jobs. Can we get crest form signed during F1 or F2 trust grade jobs? So if you have a non-training role, so for instance, if you have an SHO trust grade job, that's a non-training role, then you can get a crest form signed at the end of it. However, if you're on the foundation standalone program, if you pass your competencies during that year and you've completed that year successfully, you'll automatically be able to sit your MSRA and apply for specialty training. So I'm currently on an attachment in A&E. That's the question that I see asked right now in North London. So I've been there for a few months, and again, you just have to make the most of it. So since I've been there, I've been seeing a lot of patients, pretty much myself, just discussing them afterwards with seniors, like most F2s have to do anyway. And you just have to ask to do different things, catheterizations, bloods, documenting different things. So just be very proactive and show yourself as much as you can. Are we still able to apply for F1 since we have full registration? So there are ways to apply for F1 when the time comes. However, it would be, for us, it's a bit more difficult, and we're more limited to either F2 standalone coming from the EU or going through like applying for trust grade roles. Any other questions? Talha, do you have anything to add to any of these questions?
Yeah, with the crest form, well, I don't know if you mentioned it or not, you can usually get that signed off 3 months after you've been working in a paid role. And it's basically like a certificate which shows your readiness to enter specialty training. And then once you've done that, you can sit the exam and apply with the other F2s who are also trying to enter specialty training. Are there any other questions?
Any other questions? Any other questions of what you think you should do during your final year in uni? Anything you want us to clarify? Feel free to ask us, guys.
Are there any other questions regarding attachments?
No? Yes? So your question, regarding documents, do you mean documents for the GMC or documents for the attachment? So just the ones I've mentioned. Okay, so again, your pre-diploma or diploma, passport, internship document. Those are the main ones you're going to need throughout.
So Zaman said, how long should we try to do attachments? So, I mean, the only kind of way to transition from being a medical student to the NHS whilst being proactive is to do an attachment. Otherwise, you kind of just be in a non kind of clinical setting, and you want to be in a clinical setting to be able to develop the skills you need for when you do eventually get a paid role as a doctor. So once you're on an attachment, you just want to try and do it for as long as possible until you feel you're ready, or until any kind of opportunity opens up for you to take, and then get into a vacant position, which might become available to you through a consultant or through the track website, which Granite's mentioned, or NHS jobs.
Yeah, so basically any job you apply for in the UK, in the NHS, you would have to go through that. So it's very important. Can you clarify the logbook that you mentioned, the clinical attachment? What shall...
So I'll give you an example of what I kind of recorded during my first week. It's in my, you can kind of just keep it on your notes app and then screenshot it and just send it to your supervising consultant. So for example, during my first week, I had just put attendance at regular teaching sessions, assisting with ward round documentation, organization of information, gaining insight into the electronic patient record system to understand how it works and runs so that you can use it a bit more independently without asking other people around you, gaining information and kind of understanding how the drug chart system works, because some trusts use an electronic system for the prescription of drugs, whereas others use drug charts, which you have to kind of fill in by writing in ink. And then you also have to review the ones that are kind of written, because you have to cross them out and then refill them. So and then also assisting with different kind of documentation, such as discharge summaries, and some are urgent as well. So you can kind of say, oh, I assisted with these and I did them independently, or with some you can say, oh, I was supervised whilst doing a discharge, writing a discharge summary. Some trusts also allow you to do practical procedures once you're registered with the GMC. Some trusts don't. With the trust that I was at, they allowed me to do venipuncture, cannulation, catheterization, and whatnot. So you can make mention of that as well, just to kind of demonstrate that you have the skill set that an F1 or F2 would have, or any other doctor at your level would have. So these are the kind of things that I mentioned during the first week, and then also attending daily ward rounds, board rounds, and then also kind of mention what you got out of it. So learning how the multidisciplinary team coordinates patient care and planning and whatnot. So this is the first week, and then I sent that a screenshot of that to the consultant, and then I'm assuming he kind of understood that I'm willing to learn from this, so he invited me to. You get more opportunities by showing initiative. So then after I sent that, he invited me to the team meetings, which is just a meeting full of consultants, and then so it's a networking opportunity, and it's an opportunity to learn as well.
Yeah, so just make sure that you write everything you've done. So similarly to Tolha, like in A&E, like we didn't have like electronic prescribing, so we fill everything by form on TTA pads. So we do everything handwritten with regards to prescriptions. But again, documentations, attending handovers, any meetings, teaching sessions, and everything you've done, basically, just keep everything organized. Are there trusts that offer clinical attachment? Yes. Some trusts offer it for free. Some trusts don't offer it for free. It completely depends. So you need to check that. Unfortunately, in most places, they charge. If you're lucky to get it free, sometimes you can find ways around it. But ultimately, yeah, it would probably be paid. But it depends where you have gone to. If you go outside of London, then a lot of them are also free.
With the documentation as well, just kind of date it as well. So when you've done those things, because otherwise it can tend to be like all over the place and you won't You just keep it in like a chronological order, so you can kind of see your own progression and development to like when you started as opposed to when you finish, and that would be good for yourself and also for the your supervisor, so they can kind of see your progression as well.
Yeah, like for example, during my first week, even the first few days, I think I was more told to stay with one of the consultants to see patients and things like this. But they test you. They ask questions like Talha said. When they see that you have some knowledge or competency and you're confident, then after that, for the last few months, I've just been literally seeing patients myself. So then you have the chance to show that progression, and then more documentation. You're given more responsibility with writing discharge summaries or writing referrals, things like this. So just keep a chronological aspect to your logbook so that it shows what you have developed skills in, and it shows that you've learned something out of it.
And yeah, don't just like, obviously, like I said, there'll be some people who do a clinical attachment just for the sake of doing a clinical attachment, and then they'll make up what they've done. Yeah, don't do that, because they can tell immediately, like whether you've actually done the things you've said you've done versus when you've actually done the things you've said you've done. There's a big difference. Like they can tell who's fake and who's real, because they're experienced and they've been in the profession for like 15 years plus.
Yeah.
So they know what essentially. You can't just make it up.
Yeah, and another thing, if you show if they see that you've been around and you've been doing a lot, and you're clearly keeping yourself busy, they know that you're doing things, right? So, for example, if you're I don't know, because Talha, I think you're in orthopedics, right?
Yeah, I was.
Yeah, so in A&E, obviously, you have different sections of A&E, like resource and ambulatory care. Then you have like ambulance hub where ambulances come in. So I'm all over the place when I'm there, right? And you have to like really show that you're doing things, because if you don't do that, and you've then said, I've done this, but you've not been seen doing things, or you've not been active, they're gonna know that what you've written is completely nonsense. So make sure you're honest, and like I said, show that you've been doing things.
And once they kind of see that, it just ruins your own reputation.
Exactly.
And yeah, it's not a good look, and it just damages your prospects.
Any other questions? Feel free to ask us, guys. Now's your chance. We won't bite. We want to help you out. Okay. Anyone else have questions? So another thing I'll just mention regarding the process, the timelines it takes until you get your GMC. The first section regarding EPIC takes roughly around 5 weeks, and it's probably another month or 6 weeks after that with the GMC. So sometime you're looking at about 2.5 to 3 months before you get your GMC license. Some trusts may accept you to do a clinical attachment before you get your GMC. Most trusts will require you to have your GMC. And if you have your GMC, you'll be able to do a lot more things on your attachment because you're obviously officially licensed. So yeah, what counts as NHS experience? So NHS experience counts as anything regarding work in the NHS. So some trusts highlight NHS experience. That can be even non-doctor roles, such as working as a healthcare assistant, or if you have history of working as a nurse or an ACP or PA, etc. So that would count as experience, but also some trusts also consider clinical attachments experience. Most of them do. There's very, very few jobs I've seen there that specify clinical attachments are not accepted as experience. I think I've maybe seen it once or twice, but every other one says minimum 6 months experience. Once you've hit that 6 months, you have a very good shot at getting a job. in the sense that you have at least ticked one big box to show that you have some understanding of the system.
Yeah.
Did you guys apply through F2 standalone this year? No. And different reasons for it. Basically, the F2 standalone program has very significant requirements for certain things, but also sometimes there's faster routes to, if you want to go into training, there may be other ways that are better. So like trust grade roles, if you can get them, I think sometimes it can fast track your process to being able to sit specialty exams. So yeah, I think it just depends what you want to do.
Yeah, one more thing for the NHS experience. Some of the posts, they usually specify whether they want paid experience. So they'll say 6 months paid experience required. But at the end of the day, it's not, you want to be getting experience for yourself. Like, I know you guys want, you want to tick off check boxes and whatnot. Okay, that can be done. But you also want to make the most of the attachment through what you gain from doing the attachment as well, as I mentioned earlier.
Yeah, and I don't know how else. Yeah, go on, sorry.
Don't just go in with the mindset of, oh, I need to get 6 months done because this is what the requirement is. Go in with the mindset of, I'm going to get 6 months done eventually. It's going to count as NHS experience. But how is my NHS experience going to stand out to someone who's also done a clinical attachment? And how will it look better than the other person who's done the attachment? Because everyone who's done an attachment in the same position as you will probably be applying for the same post that you did. So you want to essentially be getting the most out of your attachment and getting strong references as well, because some references will be weaker than others.
I'm going to say one more thing, which Talha pointed out in his presentation regarding courses. So the Advanced Life Support course, guys, it's a must. When you come back, whenever you have a chance, book your Advanced Life Support course. This is absolutely mandatory because it's mandatory in the UK to get certified on ALS every 4 years. And pretty much every single job will require you to have your ALS course. Some of them may suggest it's desirable. So if you don't have it, they'll probably fund it for you if you get employed. But at some point, you will have to do it.
Yeah, it's usually essential for most jobs that are like in acute care or in acute settings. So, for example, the acute medical unit or the ER emergency department.
A&E, you need it.
Or it's even some kind of internal specialties. Some will say it's like desirable, but it's a good thing to get done.
And it will increase what you can apply for. So
increases your chances and your opportunities.
Any advice where to do it in London? So if you go on the Resus UK website, Resuscitation Council UK, and you specify you want to do the ALS course, you basically you just put your postcode in, and then you put like a radius, I don't know, 5-10 miles, and it will show you when the next courses are available, where the locations are for them. So they will be at completely random times, at completely random locations. So it's not specific to a certain center. So if you go on the Resuscitation Council UK website, you'll be able to find out when the next courses are and what locations they're being held at. So when I searched mine, for example, I put all of London, and there was options in North London, so basically everywhere. Some of them were in a month, some of them were in 5 months. So just look and book them. So the ALS course, for those of you that don't know, it's very important because it shows that you can manage, for example, cardiac arrests with different causes, and it tests your ATE assessment of patients, airways, breathing, circulation, assessing their GCS or AVPU, assessing if they've been exposed to anything, rashes, temperature. Basically,
4 H's and 4 T's, right?
The H's and T's of reversible causes, yeah. So basically, it puts together all of your clinical knowledge and assessment techniques into a situation where you have someone dying, what are you going to do? And you would be expected to show like you're leading that team. So, for example, in the assessment for an ALS course, to pass it, you'd be the person leading a resuscitation team, and you're telling everyone what to do.
Yeah, it's just essentially the management of a deteriorating patient and what to do when they're right in front of you.
Yes, anaphylaxis, shock, hypothermia, all sorts of things. But you have to do the ALS course. Like, there's no negotiation with that. So make sure you do that. Any other questions?
So I think one of the key takeaways would be to just kind of have all your documentation in line, get everything sorted early. And then especially for the clinical attachments, you want to be proactive and start looking for them a few months in advance before your kind of final state exam. Because after the state exam, I know you've got like there's a period between the state exam and the official kind of graduation ceremony. So where you might be back home, you can use that time to do an attachment, and then you can get your GMC registration sorted before the official graduation ceremony as well.
Any advice how to get a professional CV made? You know, if you go online, you can find a lot of examples.
You can, if you go on the BMA website and search example of a CV. I'll just search it now. BMA.
Yeah, you can find a lot of templates which are structured to what they
CV example, and it's the first thing that comes up, and you can use that.
Yeah, so essentially what you want your CV to include, for example, just in very brief, like what Talha said earlier, obviously your name, your contact details, a little bit about yourself and what you want to do, and then highlight your clinical experience, what you've done in uni, if you've done any research, any audits. If you've done attachments, that can be included in the research as well. Teaching, if you've done any teaching, leadership, okay, and jobs as well. But of course, tailor it to a medical CV. So don't include jobs that are not related. Of course, you can highlight that you've obtained certain skills from non-medical roles, of course. So if you've worked in a non-medical job, but you've obtained teamwork skills or leadership skills, then of course you can include those in the skills section, but focus your experience on clinical things. Because if an employer or someone who's going to take you on for an attachment looks at your CV, they're going to look at what kind of clinical knowledge or skills you have. So include your university internship.
I'll share my screen and I can kind of show the template that the BMA have got on. Can you guys see that? Granite, can you see that?
Yeah. It's you can see it.
You just got the name, like Granite said, address, email address, number, GMC registration, then your little profile, kind of clinical experience, education, awards, courses, meetings, conferences. These are all things which are kind of covered during my presentation, publications, then quality improvement projects, audits, teaching. So you have formal and informal, and then kind of hobbies, activities, interests. And obviously, if you do have hobbies or interests, like Granite just said now, that do add to kind of a medical portfolio, like teamwork, then yeah, mention it. And
yeah, it's important. And also regarding audits, a lot of hospitals, specific departments, there'll be someone who's an audit lead for that department. So each department conducts audits, for example, be it whether everyone has followed guidelines for a specific condition. Have they done all the necessary tests? What percentage of things have been done? What percentage of people have done that? What's like you can calculate those things. Anything that can be done to improve the performance of the department, or even guidelines. If you see a trend that deviates from the guidelines, right? And then you want to say, okay, the percentage of patients who have a positive CT scan for kidney stones with no blood in their urine, right? Because the guidelines here in the UK, for example, state that you have to perform, if you have a patient with signs and symptoms of a kidney stone, but then you do a urine dip and there's no blood in the urine, you don't necessarily have to perform a CT. But if you're certain that this patient may have a kidney stone, then when you write your report to CT saying when you do the request to do a CT, for example, you have to basically say the person had blood in their urine. And I've had about 7 or 8 patients in the last few months who have had a kidney stone who had no blood in their urine. So sometimes you have to go with gut instinct. So even something like that, calculating how many patients present in a different way, that can also be something to look into, because that could work to maybe adjust trust guidelines for certain things. So that's like a gist of things that you'd be looking at, for example. So to get involved in audits during clinical attachments, you can speak to consultants, but like I also said, you can speak to the audit leads. So for example, in my NE, there's one consultant who's in charge of audits. You can speak to him. He may give you for example, a topic. He or she may give you a topic on what to do an audit on, or you could suggest one yourself. Okay. And did you do audits in Bulgaria or the UK? So in Bulgaria, in the UK, it's a lot easier. In Bulgaria, I think you have to be a qualified doctor to do an audit. So you will not be able, I don't think you'll be able to do it during med school. So yeah, you can speak to your professors in Bulgaria regarding that. But your best bet is to do it in an attachment. Any other questions, guys? So I just want to remind you that on the 5th of May, we will have a second part of our series where you'll be able to hear the experiences of a junior doctor here in the UK, what life is like as a junior doctor, and also some information regarding what you may need to do and opportunities to actually work in Ireland as well. There is a growing number of people who have considered working in Ireland. So that would be something maybe that you can obtain information from. So on the 5th of May, you can sign up for that. You'll be joined by an actual junior doctor who's got more experience than me and Talha working here, who can give you a lot more insight into what life is like. But in general, be prepared to face a very different system, because I think no matter where we're coming from, there's different systems. In the UK, a lot of things are based on guidelines. You're following guidelines, a lot of documentations for various reasons, to prevent lawsuits, to make sure that you cover yourself, to make sure that you've done everything in the best interest of the patient, bedside manner. There's a lot of things that you have to be able to adapt to when you come and work here, because it's very different to maybe what we've seen in Bulgaria, where I'm sure we've all, or wherever else you've been. I'm assuming most of our audience is from Bulgaria. So, things are very different to what we would have seen there, obviously, because it's a very different system. So just bear that in mind. Any other questions, guys? Okay, so I'm hoping you've all filled out the feedback form, because that's really important for you to get a certificate of attendance. That certificate will be given to you by Career Book. So they'll be responsible for sending that to you once you filled it in. So do await that.